Good morning, sir.
Good morning.
Happy Doctor's Day, sir.
Thank you.
We are from Takshashila Vidyamandir here to interact with you, sir. I'm Harish of grade 8. I'm Amoha of grade 5. I'm Netra of grade 7.
Hello, hi. I am Dr. Karthikeyan. I have completed my MBBS from Vadamalayan University, where I continued to join and completed MD Emergency Medicine. Now I am the Chief Operating Officer of Vadamalayan Hospital and Head of Department of Emergency Department. So I have experience of 8 years plus, and I have worked in few hospitals in Madurai. Right now, I am working as the COO and Head of Emergency Department of Vadamalayan Hospital, Dindigul.
Sir, can I ask some questions to you?
Yes, please.
How long have you been as a doctor, sir?
I have joined in my MBBS in 2006. After that, I have joined and I have completed in 2015 by MD Emergency Medicine. I'm basically an emergency physician. And then I have started my practice on 2015 as completing my MD. And still now I'm continuing as an emergency physician.
So, why did you choose this career?
Because you know that my family has very they don't have more exposure in medical field, and my father is a retired police officer. As basically we know that in a family we need a doctor, right, to save our family and also the society. So that responsibility, as my father is a policeman, he was responsible to the community, and where myself also I want to be a good doctor to the society. So I joined as an MBBS, then I completed my MD, and now I'm serving for the people.
Sir, are you afraid of doctors in your childhood?
I'm not afraid, but I don't have more exposures to the hospital or anywhere else. So I do had some anxiety whether I can face a bleed or I can face any surgeries or anything. But when you get a step into the doctor MBBS, you will get courage and you will be very stubborn and you will be strong to enough to handle all types of cases.
Sir, what is your real aim?
Sorry.
What is your real aim in your childhood?
In child, I had many aims. Like I want to become an. Uh, First of all, I was very thoughtful. I should have a chef. I should become a chef because I have more interest in cooking. And then I had a quite deviation to become an engineer because on that situation when I was studying in my 11th and 12th, I had quite courage that I can become an engineer. But when I had exposure that my grandfather, my mother's Chittappa. He is an doctor. He was then in MGR University's vice chancellor, Dr. Mail Vaganandarajan. After getting inspiration from him, I thought, and I should become a doctor. And I had the main my ambition was changed as a doctor, and I had joined this course.
Sir, why are doctors' handwriting illegible? And how do pharmacists understand your handwriting?
This is quite difficult question because in early stages there were few doctors and they start to practice in many numbers of patients, right? So they have that courtesy to write very fast and see the patients, and that terms has been understood by the pharmacist. That is the common nature. But now, as per NMC guidelines, our prescription is changing to need legible bold letters. So because it should be understandable for everyone, so that terms are been changing, and we are practicing through that. We give a prescription in a typed format so that it can be easily read by everyone, including you.
So, what is the longest word you studied?
I have did my MBBS, I did my MD, I did my FICM, and I did my certificate course in diabetology and certificate course in hypertension. So I'm learning something to get updated myself.
Sir, what is ICU and what will happen in ICU?
ICU is a critical care unit, that is an intensive critical care unit where you receive unstable patients. Unstable means the patient may drowsy, the patient may have less BP, the patient may have less sugar levels, if they have fever, continuous fever, and that kind of patients can't be treated in ward side. That is called room side. Because in that area, the nurses will be there, but there will be a duty medical officer. But in critical care unit, you have a intensivists. They do MD anesthesia, they do DM critical care, and they take care of the unit. And nowadays, our MD emergency medicine is also taking care of that part. In that unit, you will be having a continuous cardiac monitor. In cardiac monitor, you can assess their cardiac heart rate, your BP, and if you have any respiratory distress, like if you have breathing difficulty, it will be continuously monitored, and there will be a 1:1. That is, each patient will be managed by each nurse. So that is the criteria we follow in our hospital, Vadamalayan hospital, where we have an intensive care unit of 30 beds. So that unit of beds have been organized by the anesthetist who has been in full time. So the doctors and nurses will be there till 24/7 with the patient. That is the special things we do here.
So why are some tablets costly?
No, it depends upon. It's not about tablets costly. It may have some drugs which will be more needed for the patient, like diabetic drugs or like any infective antibiotic. That will be depends upon, because the components which we use to prepare, it will be cost. The raw materials will be costlier. So that the but the thing is that when you see, the costly is not to specify or put burden on the patient. It to give the efficacy and to get the patient get better.
So what is the real beat of heart?
It varies on it also, like the value will be 76 to 100. The heartbeat is in the terms we say that is tachycardia. It is when it is higher in rate. Tachycardia means you can easily assess that tuck 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 tuck. That's now name is being termed as tachycardia. So that the heartbeat is increases due to maybe you get anxiety, if you have fever, if you have any issues like any cardiac problems, then the heart rate increases. So it depends upon, and when the heart rate gets low, that is called bradycardia. So when the heart rate is high, we should be very particular and we should reassess the patient whether they have any clinical condition in that, so that we can save make them safe.
So why do ambulance have different sounds?
Because we have I think 3 to 5 sounds varies to get alert the patient and public. If we have been traveling through with patient, the alarm will be different, and if you're traveling with the patient, it will be different. And when you are flying through any crowded area, the voice and the sound and volume, the pattern will be changed. So it is to alert the other people surrounding the ambulance to give way to them.
So what is the difference between antibiotics and vaccines?
Vaccines is like it should be given at the appropriate age group when you when a baby is born. From that, they have vaccination schedule to prescribe to the mother, and they will be following accordingly. But antibiotic is a term given to just you can mention that antibiotic, that is a bacterial infection, should be revert back by giving this injection. So antibiotic is given to all, it's not given to all, everyone, but vaccination should be given to everyone. That is the difference between that. If you have fever, if you have any infection, and that part you should be given antibiotic. But vaccination is not like that. It is be scheduled by the government to be given to every child to get get awareness, and they should be given injection to all of them.